Hi, I'm Dr. Michelle Proscia, and I'm going to tell you about the Patient Health Questionnaire. It is a screening instrument for depression, and it is based on the DSM-4-TR symptoms of major depressive episode. We use it to diagnose the presence of depressive symptoms, as well as to characterize the severity of depression. There are 9 questions on the instrument, and we score them on a 0 to 3 basis. So the maximum score would be 27. The higher the scores, the greater sensitivity. And the ratings are pretty simple. The first thing you're going to do is you're going to ask the question, and then you need to rate them. Your rating options start at 0 for not at all, 1 for several days, 2 for more than half of the days, and 3 for nearly every day. And so what you'll see, your scores will range from 0 to 27, going from no apparent depression, scale of 0 to 4, to minimal symptoms, 5 to 9, major depression, mild symptoms, 10 to 14, major depression, moderately severe symptoms, 15 to 19, and then pretty severe major depression if you have a rating of 20 to 27. You'll see on the slide next to me that there are provisional diagnoses and treatment recommendations for each, but we're not going to get into that right now. What we're going to do is we want to show you pretty much how you would administer the PHQ-9. Okay, so I have a model patient here, and we're going to go through what you would do and how you would introduce the test and go through all of the questions. How are you doing today?
I'm well, thank you.
Good. I'm doing pretty well. So I'm going to ask you a series of questions about how you've been doing over the past 2 weeks. Okay, so I really want you to think whether you have these symptoms or not. And when you answer them, these questions, I'd like you to think about how often you have been bothered by these symptoms. And we're going to kind of look at this rating. So we're going to look at 0 would be not at all, 1, several days, 2, more than half of the days, or 3, nearly every day. So I want you to keep this in mind. Mm-hmm. And for some patients, if it's hard for them to actually generate this, they can point to it, whatever they need to do to select the responses. Okay? So let's start with the first one. So over the past 2 weeks, have you experienced little interest or not a lot of pleasure in doing things you used to do?
0.
0? Okay, so that's not happening for you. How about feeling down or depressed, sad, hopeless?
1.
Okay, so several days. Okay. Trouble falling or staying asleep or sleeping too much, some of those sleep problems?
1.
1. Okay, several days. Feeling tired, fatigued, having a little bit of energy, not as much as you used to?
3.
3. So that's something you're really experiencing. Okay. How about like a poor appetite or food? Maybe you're eating too much food or too little,
0.
not really hungry? Okay, 0. Feeling bad about yourself, feeling as if you're a failure, you've let yourself or your family down?
0.
0. Okay. Trouble concentrating on things like reading the newspaper, watching television?
1.
1. Moving or speaking so slowly that other people have noticed it, or just the opposite, being real fidgety or moving around a lot?
1.
1. Ever have thoughts that you'd be better off dead or don't want to be here, hurt yourself?
0.
0. Okay. So for some of these problems that we've had that you mentioned, kind of the sleep was one of your big ones, and the kind of the fatigue, actually. How difficult would you say it is that you have these problems, or how difficult does it make your life, like working or at home or taking care of people? And it's going to go from not difficult at all, somewhat difficult, very difficult, or extremely difficult.
Somewhat difficult.
Somewhat difficult. Okay. Well, thank you so much for your time today, and I appreciate you being open and honest with me.
Thank you.
Okay. So then what do they do with these forms afterwards?
So after the screening form has been completed, there will be a box in the nursing office where you can drop off the form. Hello, my name is Dr. Sacco. I am a PGY4 in the neurology residency program, and we are conducting this study on the feasibility of implementing a screening tool for post-stroke depression in our patients. Post-stroke depression affects 1/3 of stroke survivors and is associated with an increased morbidity and mortality and suboptimal rehabilitation. It is imperative to screen stroke survivors as the guidelines for a comprehensive stroke center. In that effort, we have a nurse-performed screening at discharge of all stroke patients that have a radiographic evidence of hemorrhagic or ischemic stroke. The PHQ-9, as shown here. So, at discharge, all patients with radiographically evident stroke, ischemic or hemorrhagic, will be screened with the PHQ-9 screening tool. In case the PHQ-9 is not performed, on the back of the form there are several options for the reasons why the screening was not performed. Also, it allows you to elaborate on the comment sections on those reasons. It is important not to collect any identifying data on the patients, such as names, MRN numbers, and so forth. At the end of the screening, please drop the screening form in the box provided in the nursing station. The study will be completed after 3 months, and we hope to enroll 100 consecutive stroke patients. Thank you again for your participation in this study.